testing and stool examinations. The importance of macroscopic examination of urine and stool cannot be overemphasized in the microbiological examinations for the diagnosis of infectious diseases. Urine testing procedure. Macroscopic urine testing helps to detect some abnormalities in urine. Examples are detection of glucose, albumin, acetone, and so on in the urine. This is usually done in a designated room on the ward or practical laboratory in schools. Requirements for testing urine. Urine specimen glass containing the urine to be tested, test tube and rack, spirit lamp and matches, water in a gallipot, dropper or pipette, syringe of appropriate size, one receiver for water waste, bin to discard other materials, test tube holders, to test for sediment, conical urine glass, to test for reaction, red and blue litmus paper, to test for specific gravity, urinometer and a large test tube, to test for glucose, clinistis, clinitest tablets, Benedict solution, to test for albumin, herbustis, acetic acid. Method: physical observations. To observe the color, odor, and presence of sediment, the urine is poured into the conical urine glass and inspected. Normal urine is typically amber or straw-colored, clear without any turbidity, and has an unpleasant odor. A fishy smell may indicate infected urine. Obvious abnormality in the color and appearance may suggest possibility of bacterial infection, as in cloudy urine, dehydration, dark-colored urine, hematuria, red-colored urine, liver disease, tea-colored urine. To test for reaction, one stripe of red and one stripe of blue litmus paper are dipped into the urine, then observed for any color change. Acidic urine turns blue litmus paper to red. Alkaline urine turns red litmus paper to blue. If the urine is natural, there will be no color change. To test for specific gravity, pour urine into a large test tube, then urinometer is placed in the urine so that it does not touch the bottom or sides of the test tube. The number on the calibration of the urinometer that corresponds with the surface of the urine level is noted. Normal specific gravity ranges between 1.010 and 1.025. Procedure performance. To test for glucose in urine. Code tests include the use of clinistis. The test end of the clinistis stripe is dipped in the urine, removed and placed on the slides. At the end of the 1 minute, both sides of the paper are observed. A change in color from the original color indicates a positive reaction. Blue color is a positive result as you compare with the chart. Clinitest tablets. 2 or 5 drops of urine or other manufacturer's directives and 10 drops of water are measured with a dropper into a test tube. A clinitest tablet is added directly without touching it with the ends. The solution bubbles up and should be allowed to remain without moving for 15 seconds. When bubbling has ceased, the color is compared with the color chart. Dark green means no glucose present in urine, and other colors can mean increasing amounts of sugar as compared with the chart indicator. Odd tests include the use of Benedict test solution. 8 drops of urine are added to 5 ml of Benedict solution in a test tube and boiled for 2 minutes. If glucose is present, the color changes to green, yellow, or brick red. To test for albumin, the use of arbustis. The test end of the paper is dipped into the urine and removed immediately. The color is compared with the color charts provided on the bottle to determine the amount of albumin. Boiling test. A test tube is partly filled with urine. Held at the lower end, and the top inch is boiled. If the boiled portion becomes more cloudy than lower portion, a drop of acetic acid is added. If the clouds disappear, it was caused by phosphates. Such is not significant. If cloudiness remains or becomes small, albumin is present.